Hello, everyone, and again, welcome to the Extraordinary Health Podcast. Today, we get to talk about specialized ankle protocols for every stride in life, right? I am Dr. Victoria Lau, and with me always is Dr. Paul Beckham and Dr. Carly Dropick.
Hello.
Hello.
Hello, everyone. So, let's talk, guys. What do we got going on for ankle today?
We had ankle sprains and Achilles tendinitis, which are both a pain in the foot. No, it's a pain in the feet.
That's true.
Yeah, I mean, it's probably one of the most common sports-related injuries that happens out there. I mean, it can happen, obviously you play something like soccer or something like that. I mean, you can be kicking the ball, somebody's kicking the ball at the same time you're kicking the ball. You can sprain your ankle there. A lot of the field sports, football, I mean, you can just plant your foot just right and you try and push off on it and you end up spraining your ankle. Yeah, even with a regular a football stance and you're going to kind of fire off from that, you can, you know, strain that Achilles tendon and end up getting, a bit of Achilles tendinitis as well. So,
Oh, yeah. And of course, there can be, more drastic injuries like tearing the Achilles and things like that. But
yeah.
let's hope that doesn't occur. It's not
Yeah, we want to
healthy
try and
and not
prevent that as
happy.
much as possible, right?
Yes. That's why we're here, preventative methods. Here, let's chat like this.
Everybody can see everybody now, right?
Yes,
How many
exactly.
here have actually sprained an ankle?
Oh gosh,
Oh yeah.
too many times. Too many times.
When I was playing soccer, throughout the years there, I probably sprained my ankles multiple times, throughout the year. So it is pretty common injury for most people. But I think the big thing is that, if people treat it more traditionally, I mean, yeah, it's going to take a while for that to heal up. If you're really not doing much with it, if you're just kind of taping it up to give it some support or something like that, icing it at home, it's going to take a while for that to heal up. I mean, it could be anywhere from on the mild end of the spectrum, 4 weeks, 2 to 4 weeks, where it's starting to feel better. It's probably still going to hurt, to, more on the severe end. That's not a complete tear or something like that. Can take, 12 weeks to even 6 months to really get kind of healed up. So, that's why we have all the different therapies in the office here. I mean, we have, from basic things. And, I think most people always think of, a chiropractic office or something like that. I mean, that's why we call it All Seasons Integrative Health, because we do have, I would say most of the non-invasive orthopedic, or physical medicine therapies that we could have out to treat anything like an ankle sprain, from mild all the way out to severe, to hopefully get people back, playing a sport as soon as possible. And I think most people would be shocked, ha ha ha, about some of the premium therapies that we have, because the one that really works the best, that gets the inflammation out, gets the pain down, it actually even helps stimulate your body's stem cells, is our focused shockwave. And I think, like Dr. Victoria, since she started working in the office again, has probably seen just how fast. I mean, maybe not necessarily seen maybe an ankle or something like that, but how injuries, to ligaments have healed significantly faster with that as compared to other therapies.
Oh yeah, if I could go back in time, which I probably don't want to, but if I could, I would say that I probably would not have nearly as many ankle injuries as I had because I could see that the healing effect of shockwave just helps be more preventative too. After your body can rebuild stem cells and rebuild things stronger
Hmm.
as time goes on.
So yeah, I mean, I think if people want to get back on the field faster, the shockwave therapy has got to be the number one treatment now. I mean, we've had it now for like 2 years, and it's just amazing how fast people get better with it. And obviously, we're still going to need to probably use some taping or something like that, but it's going to be more the kinesiology taping just to help allow for the proper function. It's not going to be using the Zonus porous tape that's going to act more like a cast. So, I mean, Carly, have you seen some of this? I mean, Carly's just graduated from school and she's been in some offices before. She's just been here for a couple of weeks now, but have you seen how Shockwave has helped some patients here now?
For sure. I've also seen previously with athletes who have not had shockwave and try to go back too soon and then re-injure it all over again and having to go back through that 2 to 4 weeks of, re-healing again. Where versus with the shockwave, you can see how that is a lot faster and more stable once they get to go back.
Yeah, I mean, I've seen people with dislocated joints, that have been put back in. Those ligaments have gotten stretched out significantly, and just how fast it even helps to kind of tighten those ligaments back up again, just to add the stability there. So,
Now, speaking of stability, let's pull up one of these slides here, if I can remember how to do it. There we go.
Perfect.
So we have talked about stability, and yes, your body needs stability with the ligaments to keep your body moving in the right direction. But we also have this, and this has been something that I've known for a very long time. I don't know if they always taught us this in school or if we've learned it through the grapevine, but although we think stability, we also have to know that there's certain areas of the body that need to be more mobile and then some that need to be stable. And our ankle is actually one that, should carry mobility. It has to flex and extend and dorsiflex and all the fun things that keep us on our toes, literally.
Yeah, I mean, what this is really representing is, your body's kinetic chain, and you have to have areas that are supposed to be mobile and areas that are supposed to be stable. Like your ankles, yeah, there's quite a bit of mobility at the ankles, just like your shoulder is mobile there. But then you run into other joints like your knee that is supposed to be stable. Your knee is pretty much a hinge joint. I mean, obviously, it's a little bit more sophisticated than that. It actually has, they'll call it the wind glass effect to it there on how it actually moves, kind of like a cam. And your hips should be pretty stable as well, as far as stable in the joint. But again, you have not as much mobility as you do with the shoulder there, because it's a ball and socket type of a joint, and you need to have those move a little bit better there. Then you get into, yes, your lumbar spine, which should be stable, and a lot of times that's where people run into problems in that. When their lumbar spine isn't stable, it ends up causing problems with your hip, or problems with your knee, or problems with your feet. So we try and look at your body as a whole here in the office. So if you have an ankle sprain, it's not just the ankle sprain, how that's affecting you. It's then how is your body compensating and causing more problems. Typically it goes to the next joint up, and all of a sudden you'll start to notice you probably have some more knee pain, because that ankle's been sprained and you're not using it like it should. So now your ankle, and especially if you tape it or something like that, becomes kind of rigid, and it's more stable because you have that there, but you're going to stress other joints now that aren't meant to move in certain directions too. So that's where you're going to have higher incidence of knee issues then too. And that's where like Achilles tendinitis comes in. You sprain your ankle, and all of a sudden now you're putting extra stress and strain on that Achilles tendon, and that's ending up starting to get little areas where you're getting some micro fractures, or I don't want to say fractures, micro tears kind of in the tendon there. And your body's trying to repair it. Your muscles and tendons, what we would call now like your red tissue, have high vascularity to them, so they're going to heal up pretty quickly. But you also need to give them a break too, so they get a chance to heal up, and not further get injured further because they're getting overused.
It'd be interesting to again go back and see, like I recall when I was in high school and playing sports, it's like, okay, you sprained an ankle. And then they give you this big old ankle brace to wear forever. So again, reducing your mobility. But then I do recall that all of a sudden we started seeing knee injuries, like myself. I tore my
Hmm.
ACL. And then I remember all these other people did. So it'd be interesting to really see, if we held that ankle in that locked place for too long, how many knee injuries occurred because of that.
It's I bet you're going to see the incidence is pretty high,
Hmm.
and that's why, we really want to use things kind of like the kinesiology tape there to allow for normal function, give it some support, and not really lock something down so that you basically set up. You get into things like right now with court sports with volleyball. Do you really want to be, you know, taping down an ankle so that it's very rigid? And now all of a sudden your knee is having to try and make up for that motion that you don't have at the foot.
Hmm.
Yes, the ankle feels better because you're taping it there, but I think if you were to use something that's a little more functional, if you need the stability there, maybe you need to use some elasticon rather than, which is a very stretchy kind of tape, instead of using that zonus porous tape that's going to act more like a cast,
Hmm.
because then that's going to end up, causing more stresses and strains, on other joints around. When you get to the extremities, it's hard to see, because it's like, oh, you have an ankle problem, like you kind of just mentioned here too. You tape it up and you don't realize that you're now putting more stress on the knee. Whereas if you're in the spine, it affects one level, then it goes up another level, then it goes up another level. Usually it just kind of proceeds above and below the levels that are affected. So it's a little bit easier to kind of grasp when you're looking at the spinal column itself. But when you start to look at your body's kinetic chain or the skeletal system here, it'll go from like that ankle down there, you get that taped up or something like that. And it's supposed to be a mobile joint, like it's showing here. And then it ends up stressing the knee. It could even be the opposite knee, because maybe all of a sudden you're not really using that knee as much on that side and you're putting much more stress and strain on the opposite knee. And that's where you're going to end up having problems. Everybody's a bit different. It just depends on how their body then ends up compensating for the injury that they had. In this case, we're talking about ankles. So,
Hmm. I would have much rather used kinesiology tape, or we use rock tape at the office, than having that
mhm.
big stable ankle brace that I had to wrap around and that went up halfway past my calf.
I
I would
think my
have.
big thing though too, even when I first started to see, like, it was Kinesiotex was the original tape that was out there. That was the kinesiology tape. Now there's multiple different brands of tape. They all do virtually the same thing. But I personally, when I first saw it, I'm like, what the hell does this do? It's almost a consistency, almost of like a band-aid.
Hmm.
And you're like, that's actually going to support it, especially when you're so used to seeing that zonus porous tape or an elasticon type of tape, where it's using an adhesive to adhere it down to your body there. You can get literally like self grip tape, or 3M has Coban um, type tape. It's basically a tape that just sticks to itself. That can be helpful because that's going to allow for a bit more normal range of motion, but you can put it on to a point where, yeah, it is like a cast. I don't know if have you guys ever used some of the self grip tape to, tape things up, and you can kind of go either way, right? You can kind of
Mhm.
leave it a little
Hmm.
bit loose to kind of allow for, some motion or movement there, or you can literally almost make it into a cast. You can go too tight and cut off blood circulation, which would not be good. Nobody's going to like that. They're going to want to cut that off as quick as possible. But um, have you used that before with ankles at all?
I have, and especially back in college, a lot of the soccer players, when they would get their ankles taped, didn't like how tight and restrictive the typical white tape was. So they would have us
Mhm.
use some of the more stretchy stuff so they were still able to use their foot how they were used to, which makes sense now, learning these charts like this, how the ankle's supposed to be mobile.
Hmm.
Yeah, I mean, that's even how we want to, when a person comes in the office, that's what we're going to look at as far as even trying to adjust things. We have, different tests that we're going to use to test the muscles, more to find out if they're inhibited. Most people are going to think that they're weak. Obviously, if you have an ankle sprain going on, we're probably not going to do a whole heck of a lot of that until we get the inflammation kind of calmed down. But then we can go out there and kind of lightly test things and see exactly what's working, what's not working. And then that's where we can actually use like kinesiology tape, or you can literally use some of that co-band to, if they need a little bit more stability there, to wrap something up and get it more stable. And even just combinations of the two, you can put some kinesiology tape on to kind of almost act like a muscle or a tendon would act like, and then use some co-band or some self-grip tape to go over top of that to add a little bit more stability as well. So we're still trying to allow for the proper function. So hopefully then, yeah, you don't end up causing other problems here, especially
Mhm.
like with an ankle having to be as mobile as what it really should be here.
Yeah, we need to keep our joints moving, but keep them stable and find that happy medium between everything there. Sorry, my voice got lost. If y'all are following along and
So
understanding that.
I think the big thing with everything here is, we're here to try and help you get better faster, get you back to a sport or get back to life, whatever you're doing as quickly as possible and still be able to function normally here. And if you throw a brace on something, what are you going to get? You're going to get deconditioned muscles. And now all of a sudden you got to recondition them. You got to strengthen them back up again. You get a cast put on something because you fractured, an ankle, you fractured whatever. You now are going to have to strengthen those muscles back up. I'll have people, if they come in the office and they've gotten a cast on, it's like, okay, you're going to do some kind of exercises here that aren't aggravating things. We'll use some other therapies with them as well to help them out, even with healing the fractures faster too. But getting them just moving things and keeping things active so that they don't have the atrophy going on, you know, while they're having that supported is going to be super helpful with them once they get it off, because now the atrophy is going to be hopefully minimal, rather than if you just don't use it for 6 weeks, 12 weeks, depending on how long they put something on for. If you say you fractured your ankle, just moving your toes around, for heaven's sakes, can make a huge difference there. And if they give you a walking boot, making sure you even kind of weight bearing on that leg. Obviously, you don't want to put any weight on it, if it's going to cause any issues there, but trying to stay active and using things as much as possible without aggravating anything, so that fractures can heal up and all that. You're going to have less rehab that you're going to need to do once you get out of it.
Hmm. Absolutely. So of course we covered quite a few things, a few of the therapies here at the office, but we always just recommend, if there's somebody in your life that is struggling with, Achilles tendinitis or any problem with your ankle, whether it's a sprain or even just some simple pain that you'd like a closer look, please contact our office, and continue to follow along with our health podcast as well, and learn what we have to
Mm-hmm.
offer at the office and how we can help you and your friends and family.
Yep. I mean, we always have free consultations, and, depending on what you need, we'll outline for you exactly what you think you need. We'll give you an idea as far as what treatment is possibly needed, what things will cost, so that there's no shock going forward. And you'll be able to make a decision, to see if you want to move forward with that treatment plan or not. So,
Beautiful. So follow along, Extraordinary Health Podcast, and we will see you soon with our follow-up episode.
see you in the next one.
Bye-bye.
Bye.